The defense nearing the end of its case in the Lindsay Clancy murder trial, with the jury now preparing for what could be this critical stretch of testimony and eventually deliberations. Closing arguments could come as soon as Monday. A hospital chaplain who visited Clancy more than 200 times taking the stand, describing what Clancy told her about hearing that voice and the deaths of her children that followed. Correspondent Christina Thompson joining us live with the latest. Christina?
Yeah, this case is coming to a close, the defense nearing the end of its case in the Lindsay Clancy murder trial, with more expert testimony expected today before prosecutors begin calling rebuttal witnesses. On Thursday, jurors heard from Sheila Kavanaugh, a chaplain at Brigham Women's Hospital, who visited Clancy more than 200 times after the killings.
She alluded to having heard a voice, and the voice, according to Lindsay, told her that if she did not follow the command, neither she nor her children would be safe.
And did she indicate whether it was a male voice, a female voice, loud, soft?
She alluded to the fact that it was a male voice and it was persistent.
But prosecutors challenged that account, pointing out that Kavanaugh never documented the alleged voice. That follows testimony from forensic psychologist Dr. Paul Ziesel, who's met with Clancy roughly 60 times since the killings. Ziesel testified that Clancy suffered from severe mental illness, including bipolar disorder and postpartum psychosis, and concluded she was not criminally responsible for killing her children. Today, the defense is expected to call forensic psychiatrist Dr. Philip Resnick, who has experience in postpartum disorders. Prosecutors are then expected to call 3 expert witnesses in rebuttal as the case moves closer to closing arguments, which will likely happen on Monday or Tuesday. Now, outside the courthouse on Thursday, hundreds of women, many dressed in pink, gathered in support of Clancy and to call attention to postpartum mental health. Both sides agree that Lindsay Clancy killed her 3 children. The question now for this jury is whether she was legally responsible for those killings or whether mental illness left her unable to understand or control what she was doing. Back to you.
Christina Thompson this morning for us, setting us up. Thank you. Let's bring in our guest, media psychiatrist, Dr. Carole Lieberman. Good morning, Dr. Lieberman. Meanwhile, we've seen, you heard in Christina's reporting, and I'm sure you saw it in the coverage yourself, these women, hundreds of them showing up in pink yesterday. They're there to support her and Clancy. These women, they're wearing these shirts with these messages that say peace for Lindsay, justice for Lindsay. One woman was even quoted saying, "We are scared because nobody takes us seriously. Nobody wants to hear us. And really, we just need to be heard. I have been dismissed plenty of times." They're identifying with Lindsay as a mom struggling with a number of things rather than necessarily, defending what prosecutors say happened here. Well, tell me how prevalent this is. I think what is taking a lot of folks by surprise is the number of women showing out to say, I see her. I've been her before.
Yes, this is showing how much more prevalent postpartum depression, postpartum psychosis is, that it is touching so many women and they're willing to come out there and protest or, support her. It's not really a protest. Well, they are protesting. I mean, that's another part of it, actually, not only to show support for Lindsay, but also to show how fed up they are with the mental health system. And that really, is very important because certainly the mental health system failed Lindsay. And we need to give, and her husband failed her. And that's what they're saying as well.
Yeah, and then, the number of prescriptions she was on, and Doctor, before I leave you on this, we know there have been lawsuits filed against some of the practitioners who were writing those scripts, offering that treatment. Medicine just needs to be, do a much better job in terms of, continuity of care, does it not?
Yes, and also psychiatrists have to stop being pill pushers. They've become pill pushers, and they need to go back to doing therapy along with giving medication if the person needs medication. So yes, this reveals a hole. I mean, the mental health system has been failing gradually for years.
And the focus back to a general practitioner coordinating all care and having a patient-centered home would be critical. And one idea, one place to start. Dr. Carole Lieberman, thank you.